Hi, my name is Dayne DuVall, and I am the Dementia Education Coordinator for Nova Southeastern University, the College of Osteopathic Medicine, and the Geriatric Workforce Enhancement Program. So today's topic is let's talk about dementia. Again, here are my qualifications, and you'll know that I'm also a nationally certified Alzheimer educator, and I'm also approved by the state of Florida to provide dementia education. So here's a short video that I want you guys to watch, and then we'll talk about things after it's complete.
What is Alzheimer's disease? www.aboutalz.org.
Okay, I'm trying to get us to the next screen. Sorry for the difficulty here. Sorry for the difficulty here. There we go. Sorry about that. So anyway, I want you to understand the basics of Alzheimer's disease and dementia. So remember that a lot of times it's confusing because people say Alzheimer's and dementia, someone has dementia and then they get Alzheimer's. So I want you to understand that dementia is this umbrella term for all forms of cognitive disorders. Alzheimer's disease is one form, and we understand there's over 100 different forms, but primarily there's 4 or 5 that most people deal with. Alzheimer's is the most prevalent for about 2/3 of all cases. And a lot of times it's combined with vascular dementia. Vascular dementia happens during mini strokes, or what are called TIAs. Anyway, so from the NIA, which is the National Institute on Aging at the National Institutes of Health, here's the real definition of Alzheimer's disease. It's an irreversible, progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest of tasks. It is the most common form of dementia in older adults, and while dementia is more common as people grow older, it is not a normal part of aging. Keep that in mind. Dementia is not a normal part of aging. So here are the 2020 Alzheimer's Association disease, the Alzheimer's disease facts and figures. So it is the 6th leading cause of death in the United States. And actually, most scientists and researchers feel that if on a death certificate, the medical examiner could also have a box to check, let's say someone died from pneumonia, but it was contributing factor was Alzheimer's disease. Alzheimer's would probably move up to the 3rd leading cause of death. This is quite interesting. 50% of primary care physicians believe that the medical profession is not ready for the amount of people who are getting older and having some form of dementia. There are more than 5 million Americans that are living with Alzheimer's disease, and 1 in 3 seniors, and that would be 65 and older, dies with Alzheimer's disease or another form of dementia. It actually kills more than breast cancer and prostate cancer combined. 16 million Americans provide unpaid care for people. This is something that I'm going to talk about a little bit once we get through these facts and figures. But in 2020, we know that the cost of the out-of-pocket cost was about $305 billion. Now that is the cost of that people pay out of pocket. It's what the what Medicare and Medicaid pay. It's what insurance pays. Keep in mind that it's such a long-term illness that you don't really go to the doctor that often because of Alzheimer's. So really a lot of the money that's expended is in the form of this 16 million people who provide unpaid care. If you were to put a price tag on that unpaid care, keep in mind that the facts and figures of that is there's 18.6 billion hours, and that would be valued at about $244 billion this year alone. So you add 305 billion and 244 billion, and you've got the most expensive disease on the planet. That's just in the United States. So we know that deaths are going down for heart disease and those types of related illnesses, but Alzheimer's disease, the deaths are increasing. Although recent research has just shown that the prevalence is actually going down for the people that have Alzheimer's disease and dementia, and hopefully that will continue. But I think that's really because of the number of people that are in the age group of people who have forms of dementia. So here are the 10 warning signs, and this is also provided by the Alzheimer's Association. So we're talking about memory loss that disrupts your daily life. It's not, oh my goodness, where are my keys? Where are my keys? I've got to get one of those tile things because I never remember where my keys are. That's not memory loss, and that's not disrupting your life. However, when you find the keys and you go, what are these for? That's memory loss that disrupts your daily life. Also, number 2, challenges in planning or solving problems. This could be a variety of things, but my father died from Alzheimer's about between 10 and 11 years ago, and he had a long battle with this disease. And I remember that one of the problems that he had at the beginning was trying to figure out how to do things in the order of the day. Like he would go to the store and realize that he should have been going to the office. So making those plans didn't work well for him. Also, difficulty in completing familiar tasks. I know that one of the things that he could not remember was his 4-digit PIN code. So he would go to the bank, or he would go to get something, go to get money out of the bank, and he couldn't remember that 4-digit code. Additionally, he couldn't remember how to tie a tie. So those are some things that are difficult for people to understand in these warning signs. Number 4 is confusion with time and place. This happens quite often for people that they just get discombobulated. Again, they may have meant to go to the office when they went to the store, or they get someplace and they just don't recognize the surroundings. That is going to really create problems, especially if someone is driving and can't remember how to get back home. Also, trying to figure out how to translate visual images and spatial placing. A lot of times people will have a difficult time with steps, or have you ever been walking along and you misjudged a curb, things like that. It also in many places, a dark stripe or like an edge of a carpet or a floor, a decorative floor, that might be perceived as a hole in the ground or a step when it's not really a step. So that's, if you see that that continues to happen, and what can happen from that is then it also creates a fall risk. So one of these things that we're talking about today is word salads. And those of you who either might be having issues with this yourself or a loved one or a friend, you might recognize this. So I went to the, well, you know, I went over there, and you know what it's called. So I went there, and yesterday, oh no, maybe it was the other day. No, okay, so, and then it was over, and I couldn't believe it. It was the funniest thing you've ever heard. You know what I'm talking about, and you know her, what's her name? So how many of you have had this discussion like that? So it becomes a word salad. It becomes issues with people that aren't able to communicate. So that is one of those things that people get really good at hiding. So instead of saying the word, they will then go around the block to explain where they went when they could have said, I went to the store. Again, misplacing things and losing the ability to retrace your steps to find them. Again, it's not about losing your keys. It's about putting a hammer in the freezer, or it's about being misguided as to where things go. You might find a piece of clothing in the trash on numerous occasions. Different things like that where they meant to put it in the clothes hamper, but somehow it ended up in the trash. Poor judgment or even decreased judgment can really be a problem, and especially we're seeing that happening with people for phone solicitors that will end up people give everything away because they just didn't they didn't have the judgment to differentiate between someone that they should be trusting and someone who they can't. And we see this withdrawal symptoms happen a lot when people are still working, or like if let's say your husband normally liked to be social, and then all of a sudden recently he doesn't want to go to dinner with lifelong friends or go to a picnic with the community or with the family. A lot of times that's because they're embarrassed about the fact that they're losing the ability to communicate. So keep that in mind. I think what you want to do is don't keep them from being engaged socially, because that is really unhealthy, but try to draw them out of that withdrawal. Also, you'll see changes in mood and personality on a regular basis. If somebody starts doing something that is completely out of the norm, For instance, not paying the bills or hiding the bills because they didn't pay them. These are different things that can show you that could lead to the warning signs of Alzheimer's disease. And this is different from the normal means of aging. So, is it Alzheimer's or dementia? Again, remember, it's an umbrella term, dementia is, and Alzheimer's is just a form of dementia. A lot of people use it interchangeably, and even sometimes I do, but Alzheimer's disease is a specific disorder. The other forms that are prominent are vascular dementia, and again, I mentioned that as a lot of times. It actually can sometimes show up before Alzheimer's, and so a lot of times, again, those are what I call a combo platter. There's dementia with Lewy bodies. These are all different types that progress differently and affect different parts of the brain. Remember, the brain is dying and that this is a fatal disease. And so you have to keep that in mind when either providing care or wondering about what the future holds. Frontal temporal dementia is usually at a younger onset, usually 45 to 50 years old. It affects the frontal part of the brain, which has to do with personality, again, personality disorders or change in personality or behaviors. And then you've got early onset dementia, and we hear a lot about that lately because it's happening more frequently. It's still a very, very low prevalence. And however, this is something that usually happens again much earlier than 60-year-old, which is normally we see people later in life between 70 and 80, normal progression of Alzheimer's disease. But early onset Alzheimer's usually presents between 45 and 50 or 55, and it's a much shorter term. The disease progresses much quicker, and in some cases it can be passed down to children. So we don't know what the cause of Alzheimer's and dementia is. We're still trying to figure that out, and that's what makes it very difficult for a cure or even a treatment, because we don't know what causes it. But we know that the effects of it is damage to the brain cells. Again, your brain is dying. It interferes with the ability to rejuvenate the cells, and also I look at it as, especially communication, is the brain cells are misfiring. They don't have the ability to go from this place to that place, and so it gets very confusing, and that's where the word salad, that's where the judgment goes awry, that's where you'll see the personality change. We know that thinking, behavior, and feelings are affected. Like I said, particular parts of the brain are impacted, and these different regions have different effects on our functions. We know that different regions affect memory, judgment, and eventually movement. Keeping in mind that this is a brain disorder that will eventually cause the entire body systems to malfunction. Why do we say get a diagnosis? It's because the condition might not be dementia. I had a friend several years ago. I had just spent the holidays with her and her family. And she called me a couple of months later and said, "Oh, Dayne, I think my dad has Alzheimer's." I go, "Okay, first of all, no. But tell me what you're thinking." "Well, he's just, every time I call him, he's very distracted. He used to play golf every day. He's not interested in that. I call him and he's very forgetful. We talk about his grandchildren and he can't remember their names." I said, "Okay, let's do this. Get him to his primary care physician and have a complete workup. And let's go from there. Don't assume that this is Alzheimer's disease." Come to find out, he had a serious thyroid problem. The only thing they had to do was prescribe a medication, and within less than a month, he was back to playing golf. He was his old self. So imagine if she had not taken my advice and gone to his physician. Imagine if they hadn't gotten a diagnosis and just assumed that he had Alzheimer's disease, and then he had progressed and would have had a physiological problem that could have been solved, but because they didn't go for a consult, he would have had much more serious health problems. So again, the condition could be depression. Again, the thyroid problem could be medication side effects, deficiencies in vitamins, and believe it or not, alcohol abuse can have a form of dementia. And sometimes it's not reversible, the specific kind of dementia that's from alcohol abuse. Another good reason is to get a diagnosis is to understand what type of dementia it is. The reason for that is there are certain types of dementia that are contraindicated for certain medications. So the best thing to do is to consult with a neurologist, and the best team is a neurologist and a neuropsychologist. And that's not available in all communities, but it's a really good way because the neuropsychologist drills down to help figure out what form of dementia this is. And it also helps you make plans for the future. Again, dementia and Alzheimer's, these are fatal diseases, but most of them take a very long time before someone dies. So you want to make plans for the future. It's not, in the case with my father, things were going along just fine until they weren't. And we hadn't made plans for that. And so it's really sad when you're forced to make a decision last minute when you could have been planning this all along. Again, there is no cure. There actually is no treatment that stops or slows the progression of Alzheimer's disease specifically. Basically, the drug treatments, it's really about modifying someone's behavior, in my unprofessional opinion. And they only work, these medications that are developed specifically for Alzheimer's disease only work in about 50% of the population. What we call non-drug therapies or non-pharmacological treatments and therapies, they do help to a degree manage behavior systems. And I do a presentation about communication strategies in dementia care. And I always say that, you know, when someone is acting out or having behavioral problems, they're just trying to tell you something. Keep that in mind as you're dealing with loved ones and family members. But it really, the medication really is only there for a short amount of time. What we do as healthcare providers and care providers in general is really about being hands-on, and it's time intensive, and it's frustrating, and it's difficult, and it's time consuming, and it's healthcare consuming, and it's normally provided primarily by family members and friends. Eventually, full-time professional help is going to be needed as the disease progresses, and that's usually done in a long-term care community. So again, that's where the planning comes in. The number one risk factor for Alzheimer's disease is age. So as you get older, the prevalence is higher. There is a risk factor, like for instance, having a family history. My father, especially a parent who has Alzheimer's, I am, according to statistics, 16 times more likely to contract Alzheimer's disease than someone whose parent doesn't. It doesn't mean I'm going to. Genetics, what's interesting is this is not as genetically passed down as a lot of other, especially forms of cancer, but we're studying more and more about what the value of that is. We know that head injuries, especially multiple head injuries like boxing or football injuries, that can lead to forms of dementia, and actually heart health as well. So make sure that you're monitoring that, and those are part of the preventions. And what we say is that the risk of all of the unhealthy lifestyle or unhealthy conditions, cardiovascular disease, which would be high cholesterol, high blood pressure, diabetes, those kind of things can contribute more to Alzheimer's disease and dementia. So if you can reduce those risks, then that's a form of dementia. A form of prevention. Obviously, we know that regular exercise and heart-healthy diet helps. One thing that really does help is the social connection, and we see a lot of studies that people who have the ability to continue to learn is a form of prevention, and also those lifestyle changes above that can reduce the risk of these forms of poor health. So here are some resources. I'll leave this up for a while. If you want to, just take your phone and take a snapshot of this. These are excellent resources for family members and those of us, even those of us that do this professionally, but these are really good places to get information. The very last one, ADEAR, the Alzheimer's Disease Education and Referral, that's provided by the government, and it's really good resources to get help all across the country. Here's some other resources. These are some really good places to go to for just help during a rough time. The best advice that I can provide for family members and friends is education. Reach out, go to these resources, find out what the local Alzheimer's Association provides for you, the Alzheimer's Foundation. You can find programs through this. If you want to be a part of clinical trials, there's information here. Again, take a quick snapshot of this. And my information will be at the closing, so that if you wanted more information, I'm glad to provide it to you. This is really great basic information. What is dementia? The 10 warning signs that I went over earlier. Self-care. This is something that is hugely important. So many people do not take care of their self, and so therefore they're not able to take care of their loved ones. Where we see this happening a lot is that a lot of spouses predecease their other half because they do not take care of their health. And then here's help for families. Again, these are really great resources for you guys to understand and to understand better what the disease looks like. And it's also available in Espanol. So here, for people that need these resources in Spanish, here are those same 4 resources. Go ahead and take a quick shot of that. And so we've come to the end, and I want to thank you for your attention. But what I really need you to do is, if you have an iPhone, take that out and go to that square in the middle, and then it'll lead you to this survey. If you have an Android, I know that there is an app that you can get. And if not, just take a picture of this, and then you can go back later and enter the web address. And when you get there, it's going to be very simple 6 questions and answers. But go ahead and put in the first question, or it's not even a question, just presentation title. It's "Let's Talk About Dementia." So if you'll put that in. Again, this is part of Nova Southeastern University, and we'd like to get feedback for the education that we're providing. Again, this is we've just finished year 1, and we've got 4 more years, so we'll be continuing to provide education to the community. And again, this just gives us an idea of how well we're providing education, and also gives you a chance to say other topics that you'd like to see. Also, we'll be providing COVID telehealth, or online doctor's appointments information. So look for that information following, because we'll be starting that up in September of 2020. Again, here's the survey information. And here's my contact information. Again, my name is Dayne DuVall, and I am the Dementia Education Coordinator for the GWEP, the Geriatric Workforce Enhancement Program at the Kiran C. Patel College of Osteopathic Medicine at Nova Southeastern University. And again, I want to thank you for your attention today, and please reach out to me if you're interested in more information, or if you'd like for me to conduct this live to your group, or if you like I provide it as a live webinar, or if you're meeting in person, please contact me. I'm also available there. Thank you very much.